Welcome to the Sarah Finkelstein Show. Today is February 18, 2022. Do you know about the preventive services available, preventive screenings available to you on Medicare? Well, first, let me just backtrack and let you know about Medicare. So Medicare is the federal health insurance program for people that are 65 and older, but it also covers people that may be younger than 65 who may be on Medicare disability because of a disability. So just be aware that there are people younger than 65 who are on Medicare. And Medicare does offer a lot of preventive screenings. So I'm going to turn to my list because there's so many of them and I don't want to miss out on any of them. So the preventive screenings are, and this is all under Medicare Part B as in boy. Now remember, Medicare Part A is the hospital portion, but it also covered skilled nursing facility and hospice care. But Medicare Part B is your doctor visits, procedures, and treatments and screenings. So let's get started. The preventive screenings are, and there's a whole slew of them, abdominal aortic aneurysm screenings, alcohol misuse screenings and counseling, bone mass measurements and bone density, cardiovascular disease screenings. But wait, there's more. Cardiovascular disease behavioral therapy. Then there's colorectal cancer screenings and several under that relating to that specifically. Depression screenings, diabetic screenings, diabetes self-management training. These are all preventive under Medicare Part B. The flu shot, glaucoma tests, hepatitis B virus infection screening, HIV screenings, lung cancer screenings, mammograms. Did you know nutrition therapy services is also included? Obesity screenings and counseling, a one-time welcome to Medicare preventive visit. We'll be talking about that shortly. Pneumococcal shots. I hope I pronounced that one right. Always seem to have a trouble with that one. Prostate cancer screenings, sexually transmitted infection screening and counseling, COVID-19 vaccines, hepatitis B shots, and of course, I already said pneumococcal shots, tobacco use cessation counseling, and your yearly wellness visit. So let's talk about your yearly wellness visit. If you've been on Medicare for more than 12 months, you can get your yearly wellness visit every 12 months to develop or update a personalized prevention plan to help prevent disease and disability based on your current health and risk factors. So there's no cost for this preventive visit. The Part B deductible will not apply. However, you may have to pay coinsurance, and the Part B deductible may apply if your doctor or other healthcare provider performs additional tests or services during that same visit. These additional tests or services aren't covered under the preventive benefits. So there's no cost to the preventive benefits. So what is this yearly wellness visit? This personalized prevention plan is designed to help prevent disease and disability based on your current health and risk factors. Your provider will ask you to fill out a questionnaire called a health risk assessment as part of this visit. Answering these questions can help you and your provider develop a personalized prevention plan to help you stay healthy and get the most out of your visit. Now, this visit can also include a review of your medical and family history, developing or updating a list of current providers and prescriptions, your height, your weight, your blood pressure, and other routine measurements, detection of any cognitive impairment, personalized health advice, a list of risk factors and treatment options for you, and a screening schedule, kind of like a checklist for appropriate preventive services and advanced care planning. So your provider will also perform a cognitive assessment to look for signs of dementia, including Alzheimer's disease. Signs of cognitive impairment include trouble remembering, learning new things, concentrating, managing finances, and making decisions about your everyday life. If your provider thinks you may have cognitive impairment, Medicare covers a separate visit to do a more thorough review of your cognitive function and check for conditions like dementia, depression, anxiety, or delirium. If you have a current prescription for opioids, your provider will perform services during your visit. So remember, every 12 months, after you've been on Medicare Part B for at least 12 months, you get this yearly wellness visit. And it is to your advantage to take advantage of this visit, which is preventive. Now, there's also a Welcome to Medicare preventive visit. So when you first go on to Medicare, within the first 12 months that you have Medicare Part B, now you could have Medicare Part A, which is the hospital portion, and still be working in a job and have group health insurance, and you do not have Medicare Part B. But this Welcome to Medicare visit applies to having Part B in place. So what is this Welcome to Medicare visit? This visit includes a review of your medical and social history related to your health and education and counseling about preventive services, including the following: certain screenings, flu and pneumococcal shots, and referrals to other care if you so need it, height, weight, and blood pressure measurements, a calculation of your body mass index, a simple vision test, a review of your potential risk for depression and your level of safety, and an offer to talk with you about creating advance directives. So this happens, you have to do it within the first 12 months that you go on Medicare. And be aware of all of these preventive services available to you on Medicare. And remember that there are 4 parts to Medicare. Again, Part A is the hospital portion, which also includes hospice care, some home health care. And Part B is your doctor visits, your outpatient procedures. Basically, the way I like to explain it is Part B is pretty much anything that happens outside of the hospital. And Medicare Part C is the Medicare Advantage plan, which is an alternative to original Medicare. In other words, it's a replacement to original Medicare. So what is original Medicare? Original Medicare allows you to go to any Medicare provider anywhere in the nation, whereas Part C, the Advantage plan, is a network-based plan and a calendar year plan. So it has its own providers, and it's designed for you to use those in-network providers. And the fourth part of Medicare is Part D. D as in drugs, that is your drug plan to help you pay your the copays for your prescriptions. So a Part D plan is available as a standalone drug plan. That's if you have original Medicare, or it could be embedded as part of a Medicare Advantage plan. So you can find the Sarah Finkelstein Show on iHeartRadio, Spotify, SoundCloud, YouTube, and you can even Google the Sarah Finkelstein Show. We look forward to seeing you next time with some more valuable information. Oh, and by the way, we are having a few educational workshops coming up locally in Boca Raton, in person, live. Social Security planning is going to be on Saturday, February 26th, and also Thursday, March 3rd at 7 p.m. And in April, on April 2nd, we are having a Medicare educational workshop designed for those individuals that are aging into Medicare at age 65. Thank you for joining me on the Sarah Finkelstein Show. Until next time.